I got started in this line of work of medical interpretation when I started volunteering at a hospital back home in Arizona. I was in the PACU as a volunteer cleaning, and very frequently people would ask if I could help with limited English proficient patients. And one thing led to the next. I became a volunteer interpreter for a year, and that's how I gained my experience. Off the bat, one of the most challenging things is probably not the most obvious. It's actually interpreting jokes. People's humor is very difficult to interpret. Things like very colloquial speech and jokes can actually become very difficult. But aside from that, and on a more serious note, it's difficult, I think, for a lot of professions here in the medical field to give bad news. You need to kind of center yourself, be present in that interpretation, and try to maintain a neutral position. And so, although you want to be very human and compassionate, it's very important that you communicate the message. What I find most rewarding about being an interpreter is being there for someone in a very vulnerable moment, a very private and intimate moment, and to be a voice and to be a person that can very accurately communicate their concerns. I think that's something that transcends all types of barriers. I personally have been inspired to be a doctor or possibly a physician assistant, and so that's something that I can say I have very dear to my heart, and I've learned so much from just being in the encounters and being a part of that exchange, and you learn how to treat people right. No, it was just cough and cough.
And at that time you were hearing that high-pitched noise.
Y en ese momento estaba escuchando esa
Most people give me a funny look whenever I tell them I'm a phlebotomist. Most people aren't familiar with that term. I usually just have to tell them I'm the person who draws your blood, and they ask if I'm a nurse. I'm saying no, I'm more specialized in I only draw blood and that's it. The reason we collect blood samples is because you can tell a lot about what's going on in a patient just by their blood work, and it's much less invasive. Before this, I was a medic in the Army up at Fort Lewis, Washington, just south of Seattle. I was in for 4 years. It taught me all the skills I needed to know in order to get into the healthcare field. Medics are taught more than this, but I had a really good knack for blood draws, and it's really helped me kind of refine my craft and make sure I'm able to draw a patient's blood with little pain and very, very much ease. One of the big challenges, of course, is making patients feel comfortable because nobody likes blood draws, nobody likes needles. So we just try to talk to the patient to calm them down. We have protocols in place in case something happens. But mainly is every phlebotomist, one thing we're taught is very good bedside manner and just how to calm down patients, and also keeping up with our skills so all of us can do it with relative pain and ease. The kind of person it takes to be a phlebotomist is somebody who's, number one, dedicated to their work and dedicated to their patients. Number two, it also takes a high degree of skill, and it's almost like an art form to draw the blood without hurting the patient, without hurting yourself.
I got involved with X-ray as kind of like a family thing. My whole family's always been in medical. That wasn't my sole purpose for doing it, of course. So I wanted to be in a field where I got to interact with people as well as help them, and this was just something that kind of fit well for me. Where X-ray fits in as far as medical care goes is more kind of when you need to see things in the body that you can't see from the surface. So if there's something going on internally that they would like to look at without getting too invasive, they use us just to get images of what's going on the inside to kind of give them a map of what they're looking at instead of doing something more invasively. Some of the things that we can find in X-ray would be anything from broken bones to possible blockages in the abdomen. You can also check your heart and your lungs to see what condition they look like, whether heart enlargement or if there's any fluid or anything in your lungs. And checking for hardware, as far as surgery is concerned, you can check to see, make sure screws are in the right place or drains, anything like that. The most rewarding part about my job is getting to work with people, definitely. In any way, shape, or form that I can interact with someone, whether it's helping them form an exam or just saying hi in the hallway, I would definitely say the most rewarding is getting just to work with people in general. All right, perfect. We are all finished.
Children of all ages, Wrigley Brothers and Barnum and Bailey is excited to be here at the Rush University Medical Center here in Chicago to bring you the greatest show on earth! This is the Circus Extreme!
What we're doing here today is celebrating these children and their amazing fight. We're engaging with them, giving them some love, giving them some joy, telling them all these people care about them. Even more so, from our point of view, is a donation to help the everyday kind of struggles that our children go with. Families who can't have enough food. We have families who can't get Christmas presents, families who have to quit their jobs, families who don't have winter coats. All of their energy and effort, money is put into fighting childhood cancer.
This is the Circus Extreme! Thank you so much! Ladies and gentlemen.
An oncology technician prepares chemotherapies. We have a vast amount of chemotherapies, and the oncology technician must know the stability, the sterility of the item he's going to make so it can get to the patient appropriately and efficiently. These are cancer-killing drugs, but of course the bad problem with that is they also kill normal cells. So you need someone knowledgeable to know that, hey, this is too high of a dose, and let the pharmacist know, and they call the doctor and say, hey, doctor, this is too high of a dose. So this is a very important job. Patient safety, we have a double check system. We make sure that it is the right patient getting the right drug and the right dose. We check it 2 to 3 times, sometimes even more. The technology for the most part has changed for the doctor. For the technician, it's still about the same way, grabbing the right drug, shooting the correct amount into the IV bag or into the syringe. In the old days, it was just an IV push. They just shot it into the veins, or an IV drip. Nowadays, where the doctor actually injects it right into the tumor. The most satisfying part about my job is knowing, hoping that the medication is helping the patient get healthier to go home. It's a tough call when you get cancer. I wish that on no one, and I hope our medication has helped many a person.
Gonna open up the doors and turn it up. Gonna stamp my boots in the Georgia mud. Gonna watch you make me fall in love.